everyone. Hope you're all doing good. Guys, this AAA series, YouTube series is basically to help you all to do fantastic in your MRCPI Part 2 written exams. And the topic today which I picked up is UKMEC categories because most of the contraceptive questions revolves around this. Hope this short video would be able to help you to solve lots of questions. Yes, remember, success is the sum of small efforts which you are daily doing day in and day out, because these small efforts would take you to the peak of success for sure. Just a brief intro about the UKMEC categories. You need to know, basically this is actually to understand the indications, the contraindications, which one benefits, which method does have more risk and things like that. So how is it categorized? UKMEC category 1, absolutely no restriction. This can be used at safely without having any risk for the patient. Category 2 is always about benefits outweighing the risk. So it is definitely safe. There is some amount of risk, but benefits outweigh the risk. When you come to UKMEC 3, the risk always outweighs the benefits. So it is not recommended unless if there are no other options, only go for it. And 4, it causes a huge risk to the patient, so it is unacceptable. So whenever they will never ask you name the category UKMEC 1, 2, 3, or 4. They always ask you, you need to know this factual categories, the UKMEC categories, so that you can apply to the scenario where the patient is coming in, because usually they come with multiple comorbidities or multiple values, like it could be BMI, it could be blood pressure, observations could be very different. So which one you choose is what helps you to pick up the ideal contraception, or which is the contraception which you shouldn't choose. Let's start off, guys. So whenever you get any question, I would always say you to choose the last line first to read. What is the most appropriate contraceptive method for this patient? Here we are dealing with a 48-year-old woman presenting with no significant medical history except for migraines with aura. She's physically fit and a smoker. So here, the whole point where I need to be worried or looking into is, one is she has migraine with aura. The other one is she's a heavy smoker which smokes 20 cigarettes per day. So which one you can give and which one you shouldn't. Whenever you get a smoker, always think of not choosing the hormonal contraceptive mostly. Okay, so like contraceptive pills or even like any other contraceptive method of hormone contraception. So IUCD is the best bet here. Okay, so as well here, it doesn't have any interaction neither with cigarette smoking nor with migraine with aura, because you know migraine with aura, people are always at a risk of having these VTEs and things like that. You can see here, this is where the reference of mine, more than 15 cigarettes per day, copper T is the first, like it's UKMEC Cat 1, as well as somebody with migraine with aura at any age. So if you see a heavy smoker, more than 15 cigarettes per day, everything is Cat 1 except OCPs. Okay, so you can rule out this. But when with migraine with aura, the only Cat 1 is copper T. So that's the reason here, this is the only one which suits both. That's why I've chosen. OCPs I don't want to choose. These are all the hormonal things which I really want to avoid. Okay, fantastic, guys. Let's move to the next one. So this is how we will be doing the questions today, just to understand different scenarios, okay? So next, contraceptive method, most appropriate choice. Okay, I have highlighted the specific one so that while you are reading in the exam, they are not highlighted, but for your quicker understanding. A 35-year-old woman undergoes cesarean section, now 4 weeks postpartum, okay? Whenever you see postpartum, always check whether she is breastfeeding, not breastfeeding. So she is not breastfeeding, no history of thromboembolism or hypertension. Obviously, it indicates that she had a low-risk pregnancy, except for the cesarean section. She had 4 weeks she's at 4 weeks postpartum, not breastfeeding. Okay, so you have hormonal contraceptives all sort, COCs, Implanon, Dempa, Mirena, and estrogen patch. Obviously, the best bet here would be LNGIS. Okay, that's purely because of the timing. Okay, 4 weeks postpartum. So the best thing would be this. And for sure, you might be thinking, why not Dampa? Of course, injectable progesterone is category 1 you could consider, but there is always an element of bone loss. So even for the long term, I think Mirena is the best choice for here. Okay, so there could be, not necessarily it means that they only gave category, like they only give one option with category 1. They could give you a lot of options with category 1, but choose in that category 1, which is the best one. Okay, for example, you see here, more than 4 weeks, the best bet will always be LNGOS. Of course, if they had given COPT, then they should have given you some other things, because they don't give you two correct answers. I think still Mirena is the best bet. Hope this is clear, guys. Fantastic. The next one. See, read the distractors very well. Which contraceptive method is absolutely contraindicated? So I'm not interested in what you want to give to her, what you don't want to give her. Very easy one. 32-year-old, cesarean section 5 weeks ago. Okay, she's a postpartum lady, exclusively breastfeeding, fantastic. History of DVT, and was on heparin until 6 weeks postpartum. So obviously my choice is very, very clear here, because I will not be giving OCPs for somebody with a history of VT, right? Estrogen, because you know that already pregnancy itself has caused a VTE, and estrogen containing contraception 100% increases the risk. So it is category 4 as combined oral contraceptive pill, somebody who has a recent history of VTE. And as well as she is also, the other contraindication is she is less than 6 weeks postpartum. So obviously I don't want to give her this at all. Hope that is helpful. Okay, remember the breastfeeding part is very important. Postpartum, what you give and what you don't give. Specifically with the previous slide which I showed was for COPT and LNGOS, which you think based on the breastfeeding, whether you want to give more than 6 weeks or after 48 hours. So after 4 weeks, it all depends upon the stage of the pregnancy. Miscarriages have a different indications. So go through them, because this could be a little tricky. Okay. Okay, now the point which I need to address here is contraceptive method, which is the best and indicated for her. Okay, here I need to look into the indicated one. History of chronic hypertension. Okay, I'm dealing with a 42-year-old woman who has got a chronic hypertension. Her recent blood pressure readings are consistently 145/95. I know it is persistently elevated despite taking antihypertensive medication. She is otherwise healthy and does not smoke. Okay, so she's a 42-year-old, chronic hypertension and persistently elevated blood pressure. So you have option of COC, LNGIS, estrogen patch, vaginal ring, and POP, POP as well. 100%, you would be choosing two options. One is LNGIS. The second one is you could choose POP. Okay, but POP comes under category 2. So because this is a persistent hypertension, chronic hypertension. So the best bet would always be LNGIS. It is always category 1. POPs could be used, but it comes into category 2, where you think benefits outweigh risk, which you could do. And obviously, long-acting reversible contraceptive is Mirena, so you can go for that. Okay. And so this is what I was trying to tell. Preferred choice would always be Mirena because of the better compliance. And where did I take this reference from? This reference is purely from the guideline, others, UKMEC table, which you can see here also. They say all of this, including POP, it is CAT 1, but the complaints and the benefits which outweigh the risk, it comes under CAT 2 when you have the age, everything included. So I would still choose Mirena. Okay, guys. Next one, most appropriate method. Okay, let's see who is here. 45-year-old, 10-year history of hypertension. So probably we are dealing with a chronic hypertension. Blood pressure is 160/100, even with medications. Evidence of vascular disease, including carotid artery stenosis detected on Doppler ultrasound. Does not smoke, but has a family history of stroke. Too many problems, right? The cardiac functions are affected here. She has carotid artery stenosis, family history of hypertension, family history of stroke. She itself has a chronic hypertension. In those cases, the safest choice will always be copper T, because hormonal you don't want to touch upon when she has so many histories. Whenever you see somebody with IHDs, with chronic hypertension, if you see copper T, close your eyes and choose that, because they are absolutely always bang on correct. You could see only multiple risk factors for cardiovascular disease. Only one which will save you is copper T. Okay, fantastic. The next one. Hope this is clear, guys. So you could see these are easy to remember, because the only one which is safe is copper T here. Okay. Yes. Which is the safest and most appropriate? 36-year-old, rheumatic heart disease, moderate mitral stenosis, okay, is seeking contraception. No history of atrial fibrillation. She was recently started on warfarin of a mechanical heart valve. For a mechanical heart valve, she's otherwise stable, does not have pulmonary hypertension or heart failure. So she has a valvular disease, which is got treated with a mechanical heart valve. So, and she's also on oral anticoagulants. So once again, the best choice in this case, rather than all these hormonal contraceptives, the best one is a non-hormonal method, which is a copper T. Of course, for all these cases, barrier method is still applicable, but the problem is they are not, the compliance is very poor, and also they are not as long-term as these, right? And also there is a compulsion that they have to be using every time. So that's the reason copper T would be the best bet here. Okay, this is logically, this would be the easy choice for me, even if I haven't gone through my UKMEC table recently, right? You could see that now it is uncomplicated because she doesn't have pulmonary hypertension. She doesn't have heart failures or anything. But if you are dealing with somebody who has got pulmonary hypertension, the same thing if I had given pulmonary hypertension, probably my choice would be somewhere here. Of course, then you go for progesterone only. Okay, so that's also something you could think of, because this comes under Cat 2. With one word, the whole scenario changes, and you need to be looking into. Of course, if they have got some stroke and things where even these are contraindicated, you still go for copper T. So please customize your answer according to the scenario given, because these are all the different patients who come to us, right? Hope you're all doing good, guys. The next one. Following is the safest contraceptive method. Okay, I have given all sorts of complex scenarios because these are the scenarios which you need to be thorough with. Now we have a lady who is 40 years with a history of DVT 3 years ago. So she's coming for contraceptive advice. She's on warfarin due to a heterozygous factor V. So factor V laden mutation she has got. She's hypertensive and BMI of 36. She does not smoke, no history of smoke or ischemic heart disease. So there are few factors: 40-year-old, DVT, warfarin, factor V laden mutation, as well as in hypertension. As I always mention, whenever you have such complicated ones, go for copper T. Copper T is the easy choice for all of them, because all these one are once again hormonal, being a higher BMI with a hypertension, on oral anticoagulants, with a DVT. DVT is a key factor where you want to avoid the hormonal contraceptives. Again, once again, history of VT, you go for copper T as the first choice, as well as with BMI of more than 35, you always choose one. So it's basically the multiple factors which comes into the picture. Okay. But you must be wondering, how do I remember this? The only way to remember this is, I know your exams are fast approaching. Go through the tables thoroughly, like read like a newspaper, read once in the morning, afternoon, and night. Once, just flip through these tables and don't try to recollect. Okay. But after, like, if you have seen 5 or 6 times, remember for which one are the category 1, which will come to. Okay, so we have given you a lot of savior slides as well for the categories, but the list is endless. So that's why you have to keep on looking into these tables, which will make your life easier. Okay, the next. Contraceptive method, safest and most appropriate. Okay, we are looking into a 50-year-old woman, varicose veins, has been wheelchair bound. So that means to say there is an immobility due to multiple sclerosis. Of course, there is no history of VT or cardiovascular disease. So what is the best choice? Once again, property is always a winner, because whenever there is an immobility, you know that there is always a risk of VT and multiple sclerosis. Once again, she would be always at risk of having VT plus a 50-year-old. So you always think whether to use a hormonal method or not. And varicose veins also very important because it doesn't increase the risk of thrombosis as such. You can see everything in varicose veins, including CHC, is one. But the other factors like immobilization, prolonged immobilization, as well as the multiple sclerosis, the medical disease is something which you need to consider. The previous one which we saw, factor V Leiden mutation, see, that's also category 1 for property. Okay, guys. So I'm not trying to tell you that you have to choose property always. You should be looking into the contraindications as well and take it from there. Fantastic. Few things about the breast disease. I know you're always worried about the breast disease. So a 37-year-old woman coming to you with a newly detected breast lump, but she's been waiting for the results. At the same time, she wants to use a contraception where she doesn't become pregnant. The best choice, non-hormonal, is always property, right? Whenever you are suspecting something sinister, avoid hormonal methods. Diagnose fibrocystic disease, nothing to do. You can use any method for her, okay? And of course, in the exam, if they want to give you to choose particular one, they can give contraindications for others except one choice, which is correct one. Strong family history of breast cancer. This is very important. For example, if a mother or an aunt or a sibling has got a family history of they had developed breast cancer, you can use all the methods. No significant increase with hormonal contraception. This is very important. However, if the person whoever is in question is BRCA1 positive, you have to avoid COCP because that's combined oral contraceptive pill, because that increases the risk of breast cancer. And the best bet always would be copper IUCD, right? Even Mirena, because this has progesterone, it comes under CAT2. Next. ER positive, that is estrogen receptor positive invasive ductal carcinoma who is undergoing chemotherapy. Again, you want to avoid all the hormonal things. So the best bet would be copper IUCD. As I mentioned before, barrier contraception, you can still always choose. It's the safest one, but because of the compliance, you need to be worried. And all hormonal methods are CAT4. ER positive 5 years ago and is now in remission. Still, you would want to avoid all hormonal methods due to the recurrence risk. Properties always remains the CAT1. So invariably, if they have ER positive, if they have been treated for breast cancer, if they have BRCA1 positive, the best bet would always be property. Other than that, breast lump, diagnosed fibrocystic disease, you can choose any method. Okay. Breast lump, if it is benign, you can choose property. If it is still waiting for results, you can go for you have to avoid hormonal contraceptives. And all these scenarios were based on this. Okay, so because they always ask you BRCA, whether to use Mirena or not. That's the reason I have given this. Okay, guys, fantastic. Now, I've got a few more things. I think this was there in 2023 also. So you get properly for UKMEC category, you can get 2-3 questions, but based on different scenarios where you use contraception, also there will be a lot of questions. For example, a girl with autism, a girl with a learning disability. So you need to know those scenarios as well. I haven't covered because it doesn't fall under UKMEC. Let's see this. Best contraceptive advice, 35 years, delivered the child by cesarean section 4 weeks ago. Previous normal deliveries, currently exclusively breastfeeding. Okay, this is what I'm interested in. 4 weeks, breastfeeding. Newborn has been referred for genetic testing due to concerns about a potential inherited condition. She doesn't wish to have any children in this gap. So what is the best bet? Obviously, the best bet would be Mirena because 4 weeks gone. And I think that is the best use which you can put into. Of course, if they will never give Mirena and Copper together. If they have to give that, then they will give contraindication for one of them. Okay. Yes. This is the explanation which I would love to give. As I said, LARC is always better. And don't use sterilization, guys, please. Because first of all, this child is going for a genetic testing and she doesn't want to have, of course, even if she asks for sterilization, you should use LARC methods to give her a cooling off period. Okay, guys. And this is where my things comes from. More than equal to 4 weeks, you can use copper tiarmirin. The next one, contraceptive method is contraindicated. I love contraindications because it's easier. See here what I've given. Moderate PMS symptoms. PMS, you know that the new generation OCPs could be given. So they could also give you a lot of scenarios where you have to choose a treatment based on the UKMEC category. Let's see. Moderate PMS, request a contraception that might also help her with symptoms. She reports experiencing migraines with aura twice per month. She has no history of thromboembolism, hypertension, or smoking. So what is the best bet? So here, the thing is, we are asking for contraindication. You know that migraine with aura. Don't jump and choose copper T because that's not going to help in the PMS. But my problem is I have asked you contraindication. Okay. So that's the reason you must remember this would be contraindicated in these women with PMS. Okay. Especially with migraine with aura because that always increases the risk of embolism. Perfect. The next one, most appropriate next step in a management, 37-year-old, severe mood swings, irritability, bloating, interested in hypertension, smokes. So even though she wishes to have that, you cannot give COCP here. And the best bet, what you would choose is first recommend exercise and CBT as a first line treatment, right? Because recommending her OCPs would be probably risky for her, for a smoker with a higher BMI and who had gestational hypertension. So I would go for, so just remember these things, where to give what. Okay, I've given you a sneak peek. Of course, I think I would be needing 2-3 hours to cover all the conditions, but just to give a sneak peek of understanding, it is not the one element which you look at. You look at a lot of elements to decide which category it goes in. Hope this was of help. Don't forget to leave your comments and like and subscribe and share this channel, which would help a lot of you to achieve your dream. Thank you for all the support, guys. Thank you and all the best.